All right, Ben. About that SimuScope app we talked about, the one that claims it can turn surgical video into a game-like environment, I'm still trying to wrap my head around it.
Oh, SimuScope. Anya, it's more than just a game. It's a surgical playground. From what I've seen, it can take actual surgical footage and convert it into a truly interactive simulation. And it even automatically generates all sorts of data like depth maps and object segmentation. No more tedious manual labeling, which is a massive headache.
A playground, huh? Sounds adventurous. But our game requires incredible precision. Seeing the visual fidelity is one thing, but what about the feel? In open neurosurgery, we live and die by tactile feedback. Differentiating tissue, feeling for tension, anticipating a tear or how a nerve might stretch. That's crucial. Robotic surgery already takes some of that away. Can this game actually give us haptic sensation? Can I feel the brain tissue?
That's a fantastic point, and it's something the developers seem to be tackling head-on. The sources mention SimuScope uses 3D Systems touch devices for haptic input, is specifically designed to provide constraint force estimates, crucial for accurate haptic feedback calculations. They're pushing for refresh rates up to 1.5 kilohertz to make that touch sensation as realistic as possible. So yes, the goal is for you to actually feel the tissue. No more guessing if you're dissecting fat or a critical vessel.
Okay, that's a significant step. Feeling the tissue response, even virtually, would be a game changer. Now, for the real challenge, anatomical landmarks from every possible trajectory. In neurosurgery, our view can be incredibly dynamic and often obscured by blood, smoke, or tissue movement. And let's be honest, smaller, sparsely distributed structures like cranial nerves or tiny cerebral vessels are a nightmare for current deep learning models to accurately segment. How would SimuScope prepare us to identify these critical structures regardless of the tricky angle or obstruction?
You're right. That's where misidentification can lead to devastating complications. The current deep learning models often struggle with lower accuracy for smaller structures like nerves compared to larger organs. But SimuScope is designed to address this data scarcity. It generates a comprehensive set of annotations, including semantic segmentation and depth maps. By simulating a wide range of surgical interactions like grasping, tearing, cutting, thermocoagulation, and vessel clipping, and outputting tissue bleeding, damage, and coagulation maps, it creates a vast, diverse dataset. This data can then be used to train AI models to recognize those difficult-to-segment structures from any perspective or under varying conditions. It's like a surgical flight simulator, but for your most challenging neuro cases, allowing you to practice navigating chaos until every landmark is ingrained from every angle.
So essentially, it's about giving the AI and us enough reps in a perfectly annotated, chaotic virtual environment, a sort of grandmaster-level surgical video game where the haptic rumble tells you if you're on the right path. This could genuinely make learning those intricate anatomical variations and preparing for those high-stakes procedures feel a lot less like a blindfolded treasure hunt.
Exactly. It's about creating that risk-free environment to explore different surgical approaches and perfect our control and automation algorithms without needing real robots just yet. It could truly revolutionize surgical training and preparation, leading to better patient outcomes. We need to get our hands on this SimuScope.
Agreed. My patients and my stress levels will thank us.